welcome, Dr. Dawn Leighton. For you guys that don't know, Dr. Leighton is an ER physician who I believe is in Denmark, American born and trained, but now living in Denmark, and has a very interesting, I think some interesting information to share with us today. So Donna, if you don't mind, by way of introduction, can you just kind of give our folks a little bit of introduction about yourself? You're back on mute again. Sorry, I've got to unmute you. Let me unmute you. There you go. Now you're unmuted.
Can you hear me now? Okay. As Dr. Baker said, I'm American. I was educated in the United States, and several years ago moved here with my Danish husband. I have a history of something called Ehlers Danlos Syndrome, hypermobile type, that makes me very, I don't know if you can see that on that one, but very bendy, and my joints just sort of, I'm one of those circus people that can put their joints in any position and spontaneously dislocate them if I want to. Not that I do that anymore, but I used to do those sort of party tricks for fun. It's a genetic disorder, tends to be progressive. You end up with osteoarthritis quite young, usually in our 30s. It's pretty often when we get it. I had some other medical problems too that I was struggling with, some autoimmune disorders, a lupus-like syndrome that never quite got diagnosed, plus I have Hashimoto's thyroiditis, and it was very difficult to manage it. But Ehlers Danlos Syndrome is something that people just live in constant pain with, and it's a really difficult problem to live with. I used to dislocate my joints several times a day, and I have no idea how many subluxations I had, which means a partial dislocation, when the joint doesn't come out all the way, but it slides around or partly dislocates. It was about 2 years ago, I heard about the carnivore diet, and I read a story of, I think it was Amber Hearn, yeah, who had, her medical problems weren't the same as mine, but her story was interesting to me, in that she and her father did the controlled kind of look at the carnivore diet and had a marked improvement in their symptoms, and actually thought it sounded really insane. I did. I thought it sounded crazy, like an all-meat diet, how insane. And I actually was eating mostly a paleo diet for a couple of years before that. I was a little better on it, but not appreciably. But I thought, well, a month can't hurt me. I'm just going to try. And so the next person, I did some reading, and the next person I stumbled on was Sean Baker, and I just sort of took his approach to it, which was to dive in. You know, I never did keto, or I hadn't even, honestly, maybe it's being in Denmark, I'd never even heard of the ketogenic diet. It was just kind of passed me right by. So I skipped over that. I went straight to carnivore, and that sort of suits my personality more. I like the simpler approach. The keto seemed a little too fussy to me, and all the, you know, measuring things and figuring out ratios and all that. I'm not a diet person. I'm not somebody who has jumped from diet to diet, or I was really just looking for something that was going to help me feel better. I had gained some weight, because when you stop moving and you hurt a lot and your joints are falling apart, it's very difficult to exercise regularly, and it's very difficult to be normally active. So although I had in the past not been somebody who tended to gain weight over time, you know, if you're not moving and you're eating things that turn out not to be great for you. And for me, I don't eat bread. I didn't eat bread. I wasn't a big pasta eater. It was all the other stuff, as it turned out, which I had no idea, none at all. And so I did 30 days, and really even before 30 days, I was really noticing improvement. I started to feel better, even though I know that's the sort of transition period. I really thought there seems to be something here. So I decided to do it for 30 more days. And before I even hit that 60-day mark, I was already so much better. The pain in my joints really was starting to decrease. I was able to start working out again, and I've in the past always been a weightlifter, always worked out, and I hadn't been able to for some time. I was able to get back in the gym, and for people with Ehlers Danlos syndrome, our joints are so unstable, we really rely on muscular strength to stabilize our joints because our ligaments, the collagen that holds our joints together is just stretchy and ineffective. So we really absolutely need good muscular strength. As soon as I was able to add that back in, that really helped. But there was something beyond that. There was something happening because I've been very strong before and still in pain and still dislocating. But something happened that it was like my joints started to cool off a bit. They just didn't hurt as much. I didn't wake up in so much pain. I used to wake up with both of my shoulders dislocated pretty much every morning. Usually my hip at least subluxed and my ankle just completely dislocated. That was my morning, putting everything back in. That hasn't happened. It's been almost 2 years. I haven't had real joint dislocations probably beginning a few months after I started the carnivore diet. I really started noticing a drop off. And I have to do something like I did earlier, really stupid, to make myself dislocate now. I'm just much more stable. I sleep better because I'm not in so much pain that I'm waking up many times a night, which is very common for people with joint hypermobility. I would say my pain level is probably about 5% of what it used to be. And I take no pain medicines. I used to live on NSAIDs and took sometimes tramadol or something stronger if I had an injury that required it, and injuries were frequent. For someone my age, I'm 59 years old, to be 59 and have Ehlers Danlos syndrome and not be living on pain medicine, any orthopedic surgeon or EDS doc will tell you that's extremely rare. Extremely rare. So it's been a remarkably freeing experience. The other things that have happened has I take about half the amount of thyroid medicine that I used to take. I do not. I still don't have, the last time we talked about this, I still don't have a great explanation for that. Am I metabolizing I certainly didn't grow my thyroid back. Autoimmune thyroid is destroyed and it doesn't grow back. But am I metabolizing that better? Who knows? Or utilizing the medication better. I had to lower my medicine gradually because I noticed, I could tell it was too high for me. And I took progressive tests. My lab test showed that I needed to drop down my levels. So, being able to get off pain medicine, lower my thyroid, and be able to exercise regularly and not be constantly hurting myself has, it's nothing short of completely changing my life. Going from being basically a partly disabled person to forgetting sometimes that I have these problems.
Hey, Dawn, again, that's amazing. Sorry, just one thing, I'm just noticing a lot of feedback on your end on the microphone. I don't know if there's, whenever you talk, I don't know if anybody else hearing that? Can you thumbs up if you're hearing the feedback? Yeah. I don't know.
Dear.
Yeah, every time you talk, there's a lot of feedback. So
does it help if I change the volume?
I don't know.
Am I getting?
Yeah, sounds like
I'm not sure.
Are you, maybe the Bluetooth connection is an issue?
Yeah, but I don't have another connection here.
Are you on a phone or on a computer?
No, I'm on the computer.
Does the computer have its own built-in mic without the Bluetooth? Can you try that?
Yeah. Let's see.
See if you can do that.
If I disconnect.
Yeah.
Let me just disconnect the Bluetooth.
Yeah.
Can you still hear me?
I can hear you. We just get this really, it sounds like.
How's that? Is that any better?
No, it still sounds like we're getting, sounds like there's an airplane noise in the background every time you speak, unfortunately.
Yeah. I'm sorry. I'm not sure what to do.
Yeah. Do you have a phone?
Mm-hmm.
Can you log in on your phone? Try that.
Try.
Yeah, if you don't mind, just because the audio is just really, it's tough to listen to a little bit. So, and you have such a great story. I'd like to, so we can hear it.
Do I need to download Zoom onto my phone?
You shouldn't need to. You should be able, I think you can just click on the link and I'll bring it up.
Let's see. What's the link?
Should have been emailed to you, I believe.
Yeah, I know. It's just, it was, but I'll have to, it might take me a moment.
That's okay. That's okay. Because we're just the sound is.
I'm so sorry.
No, it's not your fault. It's just the way it is.
Usually the computer works okay, but sometimes not. Last time we talked, it was on here.
I'm just I'm just looking in the comments. There's a number of people talking about. There's quite a few people now with EDS that are doing carnivore now. So that's.
I have several people that I'm consulting for, and pretty remarkable actually. The benefits people get. Okay, there you are. I'm trying to find the. Here we go. See if I can click over from here, and then I'll go away from the computer.
Yeah, we'll see you pop in as a new. If you get on your phone, let me know when you get on your phone, and then let's see if you pop in there.
Sorry about this, guys.
That's okay.
So why isn't it going to you? It said it would open it. I clicked the link and then it just kind of went away. Let's try this again. I don't know why it's not going to. Here we go. Let's try this again.
I guess the other option would be to, you can dial in with your phone using that for audio, or you can restart your computer or log in and log out. A couple different options, but.
So it says, please enter my name.
That's fine. It'll just have you show up as,
Oh, I see. Well, at least it's responding now. Sorry. Okay.
Are you in now on the other one?
Yeah, it says.
Yeah, I can see you.
It's
Okay.
asking me to.
Mute you and unmute you. Where'd you go? Where did you go here? iPhone on. Okay, I've got you on mute. I'm trying to figure out how to unmute you real quick because. Just a moment.
How's this?
Talk a little bit more.
Can you hear me now?
Much better. Yes.
Okay.
Sorry. So we'll continue. So, and I think we could still use a beginning part, but there's this little a little bit
Are
of
you
noise.
sure?
Yeah, that's fine. I think we can use that.
Okay.
So you've got Ehlers-Danlos. You've had it for decades. You said, in the
I've
past,
had it since birth.
since
It,
birth, and you've been
it's
suffering.
genetic.
Yeah, and you've been dealing with the sequelae of this for, your majority of your
Right.
life, for sure. And it been
Right.
getting.
It was never something that I perceived as a problem. When you're younger with EDS, well, not for everybody. There are kids severely affected with EDS that have
Mhm.
problems. That wasn't the case for me. And in my family, it doesn't tend to be like that. We tend to be just really bendy, really
Yeah,
flexible, and
yeah,
uh, uh, we might have injuries, but I had no idea that, and especially since my brothers and sisters have it, my mom had it, so I had no concept that this was unusual. It took me a while to realize that not everybody could wrap both their legs behind their back, or it, I had no idea. But it really wasn't a problem for me, and until I really started having some serious joint dislocations, um, late 20s, early 30s, really. I did pretty well with
yeah,
it for a long time.
and
I
we
mean,
and
I
we
did have injuries, but I didn't connect them to anything. But I was in the gym one day and I was doing shoulder shrugs, and both of my shoulders just dropped out simultaneously. And so I was in med school, actually, and I kind of walked down to the ER with a bilateral shoulder dislocation. They said, gee, what's going on here? That's a little unusual.
Yeah, that's that is going to be a little disconcerting. Yeah, and we all know. I mean, I remember growing up. We all remember the kid, the one sort of weird kid that could do all the crazy things,
Mm-hmm.
and
I was that kid.
right. And so like I said, you start to develop the, sort of the pathology a little bit later as you have these multiple
Right.
dislocations, and of course,
Well,
every
once you
time.
dislocate something with EDS, you tend to keep dislocating
Right.
it.
Sure.
So then the joint becomes progressively more unstable. And then as time goes on, as I said, osteoarthritis tends to develop really young. I started getting osteoarthritis in my early 30s. It's really common for people with hypermobile EDS and also classical EDS that we often say we feel like we're 80 years old inside of a 30-year-old body, because you're exhausted all the time. You have arthritis. You feel like an old person on the inside. It's just a very, and plus pain, chronic pain. Once I did start to have pain, and then that becomes sort of a progressive thing. That's very, as anybody with any kind of chronic pain knows, it's exhausting, for a lot of reasons. Managing the pain itself, for me, takes a lot of concentration to manage pain, especially if you don't want to go down the narcotics route, and it means having a lot of mental control, and that can be tiring. And you don't sleep well, and disrupted sleep over years becomes a big problem for people.
Absolutely. Yeah, and I think, and one of the things you mentioned was, working as an ER physician. You're going to work trying to do the ER stuff, and you have a joint come out of place while you're at
Yeah,
work.
I had a proximal radial dislocation when I was intubating someone once.
Wow.
I pulled up on the laryngoscope, and all of a sudden my proximal radius just popped up and was tenting my skin.
Yeah.
And everybody around who was also in the resuscitation went, gee, Dawn, here, you better move you over, but it's also just, I do a lot of kind of spinning on my heel, sometimes the nurse will physically spin you around. No, doc, you're going this way. And it's emergency medicine, especially if you work in a trauma center or any place very busy, it's a full contact sport. And it's very difficult if your body is not cooperating for any reason, so that definitely became a limiting factor for me.
Yeah, and I'd spent my share of time in the ER as an orthopedic guy, and sometimes, particularly if you're at a trauma center where you get a lot of people that are either, and many of them are intoxicated and drunk and they're wrestling, and it's almost, so
A
it's like
lot of our patients, yes. I
yeah,
trained at Bellevue Hospital.
it's like a wrestling match sometimes. You got to, you're
Sure.
in there, you're in the middle of the fray trying to, kind of calm these people down, and sometimes they'll take a swing at you, and it's kind of
Hmm.
just that type of
Absolutely.
thing. So you've been now, I guess, around 2 years doing this, and
Yes. In July, it will be 2 years.
and have the people at work noticed that, hey, your Dr. Leighton's joints aren't popping out of place anymore?
Well, I mean, because here, I think I've told you the background here. Emergency medicine's a little different, and working as an American here, it's too long to get into and off topic. But so what I've been doing is the other thing I do is I run a clinic for homeless youth in Copenhagen. But yes, I mean, in general, people in my life notice, that my energy level is better, that I'm just not injured as much. I don't complain so much. People with chronic pain, it's one of the difficult things for us in our lives is that we become that person who's always hurting and always in pain and kind of grouchy and exhausted. And that's not me anymore, which is very nice. It's one of the isolating things about people who live in any kind of chronic pain is that you just become someone people don't really want to be around so much, or they worry about you. You become identified as your pain and being that person. And for me, people tended to treat me more like I was a little more fragile, because I'd get injured, and that's less and less the case.
Yeah. Now as you've sort of are no longer, spontaneously dislocating or rarely doing that anymore, you've
Hmm.
gone back to exercise, and you managed to injure yourself. I heard you had a bicycle crash now that you,
I did. I have a grade 4 AC joint separation right now. Trying to figure out what to do with it.
yeah, I mean, the
Yeah.
grade fours are, we generally, yeah, again, as an orthopedic, yeah, those are ones that we often would fix, but that's,
Right.
you're kind of probably a unique case with that, how to
Yeah.
deal with
The
that.
orthopedic surgeons are meeting to try to figure out what to do with me because I'm a little different case
Right.
than,
Sure. Yeah. I can
yeah.
see
So they're
that.
having a group of 8 orthopedic surgeons are putting their heads together to try to figure out what the heck to do with me. It's not the outcome for grafting with EDS patient. Well, you don't want to take a ligament away from us somewhere else. We need it. But also we don't really heal that well. There's delayed wound healing, and we
Sure.
tend to reject grafts. So
Sure. Yeah.
they're not really sure what to do yet, but
Yeah.
they're
Well,
working on it.
you may heal better than the average EDS patient, I
Yeah,
suspect.
exactly.
Right.
Yeah,
Yeah.
exactly. It's a little hard to get, how it is talking to other doctors,
Hmm.
uh, trying to explain that to them. I mean, they see, I had an MRI, and the first thing they said is, "Wow, you have really big muscles." And they couldn't believe they were looking at a 59-year-old woman, on my MRI because my muscles are so strong. They said, well, "There's no problem with your muscle strength or your bone density." I have great bone density, so.
Good for you. Now, if I'm not mistaken, you also, as you're in the ER and you're exposed to obviously everything, didn't you say you got COVID-19?
I
At
did.
some point, yeah.
I got it actually not in the emergency department. I got it from uh, a parent of one of my children. We had a bunch of Americans here recently. They were our kids did an exchange with some kids in Illinois, and then those kids came to us, and um, so we had a bunch of American kids here and a couple of parents, and we were all getting together a lot more than usual with all of the class parents and the kids because we were taking them around Copenhagen. And that was in about the first or second week of March. And that was right when we started having cases of COVID-19 show up. Most of our cases came from Danes who were skiing in northern Italy. Mid-February is everybody has the week off in Denmark, and it's winter holiday, and people tend to go skiing either in Austria or northern Italy. It's a very common thing for, so thousands of Danes were skiing in northern Italy, and a bunch of them came back with COVID-19. So I got exposed to a guy who was tested positive for it, and then I got sick a handful of days later. It was definitely weird. It was not the flu. But the first thing that, I'm somebody who got nausea and vomiting first, which at that time I wasn't sure, because we hadn't learned that about 20% of the people actually get GI symptoms, because it was still so early in the pandemic that we weren't sure if it was just a respiratory thing and I'm one of those ones that lost their sense of taste and smell for a little while. It came back, but I actually did remarkably well. I was worried because I'm 59 and because I have asthma, and I was concerned that I would have more trouble from a respiratory standpoint. And, I definitely got sick, and I was sick for 10 days, but I was never in anything that I felt I couldn't take care of. My threshold for that might be a little different. I have a pulse oximeter, I know how to monitor myself well enough, but I'm quite sure that if this had happened 2 years ago, I would have probably had a lot more trouble. I just felt that my reserve to be able to fight it was significantly more than it would have been, particularly if I was still struggling with autoimmune problems, for example. I haven't had a flare-up of my autoimmune problems in almost 2 years, about a year and maybe 8 months, and before, it was a constant roller coaster. I was just up and down with that. And if I was fighting that and struggling with that and then tried to manage this virus, I'm sure the outcome would have been different.
Yeah, thankfully you're better. I've got another friend from medical school who he's on a carnivore diet, and he also got COVID-19. He said he was down for a week or so and then fine. So people ask me what the outcome is, and we don't know. It's there's only a few people that do carnivore diet, so we're not going to expect too many of them to have it. But the only ones I've known have been physicians so far. So
you're right, exactly.
So it's kind of interesting to see that. Hey, let me ask you about, did you ever get anybody talk to you about doing a case report or anything like that? I know I tried to set you up with Dr. J.
I answered the email.
Yeah.
But I haven't heard anything back, unless I'm missing the email. Every once in a while, my emails sort to someplace weird, like, spam folders. And so I have to kind of go hunting for them. So I will go check again, but I didn't ever get a response back.
Yeah, I'll tag him again just to see.
Okay.
We had him on the other day, and I know he's interested in writing stuff up, and I know he had an interest in hemochromatosis. But I think your story is very much case report worthy for sure. It's
the more that we get, the more we collect. And I certainly I consult with a few EDS patients who are having pretty remarkable improvement too. It does, we're all a little different as far as how well we adhere to a carnivore diet. I think I notice a distinct difference in my patients who decide that they're really going to go for it and don't, mess around with it. And then the ones who slip back and forth, they certainly just don't see the improvements. For me, I know, I learned pretty quickly that, and I've never bothered to go back and figure out what exactly, but removing the plants seemed to make a difference. And I think in the beginning I thought, well, someday I'm going to go back and kind of test which plants it is that were bothering me, but I haven't really bothered because I just like feeling better, and maybe someday I'll get curious but for now, I just like feeling stronger. I like feeling better. It's absolutely great to be out of pain, and I just don't want to be sick again. And I don't want to, be spending half my life in bed because I'm sick. And there's no salad or whatever in the world that is worth that to me. And, you know, I've said this to you before, but, you know, I didn't have a terrible diet before. Actually, compared to the standard American diet, I had a fantastic diet, mostly paleo. I really didn't eat a lot of bread and pasta. I wasn't a big sugar eater. You know, I ate lots of salads and fresh fruits and vegetables and meat and fish and whatever. And, you know, a very healthy diet by most people's standards, you know, but not healthy for me.
Do you know, I mean, you know, obviously as a physician, you know, we get more, you know, credibility, I suppose, than a sort of a layperson does. Are you involved? Have you been involved in EDS type groups, online support groups for a
Sure.
while prior to this? And
Yeah.
how does that translate now with you saying, hey, carnivore diet's working for me? Are you getting more buy-in with
Some
that?
people are super interested. Usually I periodically will pop into some EDS groups, and I'll mention it. There's unfortunately also a lot of, there's the sort of the vegan counter programming, and lots and lots of people with EDS have been told and convinced that they need to eat a vegan diet in order, you know, to help manage their EDS symptoms. I have yet to see anybody who has had anything close to the benefit from a vegan diet as I have from a carnivore diet, and the patients that I consult with. And a couple of them actually were vegetarians. One was a vegan before, and, you know, she was pretty much falling apart. And now is getting better, you know, or is showing improvement. I don't want to, for the non-medical people listening to this, you don't cure EDS, you don't get better from it. But what you can do is control your pain and stabilize your joints. You know, and for me, eating a carnivore diet has been a tool to help me do that. You don't cure genetic illnesses with a diet. That's
Yeah.
not how.
And your story, that's one of your stories where it was so fascinating to me. And, you know, I've seen some other quote unquote genetic sort of disorders now that seem to be at least expressed differently in a different environment. I think there's, you know, maybe there's an epigenetic modification, maybe there's, you know, phenotypic expression that occurs in a particular environment. And have you given it any, because obviously you have more sort of skin in the game on EDS than I do. Have you given much thought as to why you think mechanistically this is working for you? Have you had a chance to maybe delve
Well,
into that, or is it just, it is what it is type of thing?
I think that, like so much of this, that there's a connection to the overall body inflammation, how much inflammation is going on. And I think that the part of why my joints started to hurt less, and then were able to I was able to stabilize them more because I could use them again, is that there was just less inflammation. There's a lot of microfriction that goes on in EDS where the joints, there's the big dislocations of the subluxations, but equally as damaging, and possibly more so over the long term, is the constant rubbing back and forth inside the joint, right? So there's this constant movement, and it creates this sort of microfriction and inflammation. But also, I think that there was something about taking plants out of my diet that calmed down some of the overall, my joints just don't feel as hot and swollen and irritated as they used to. And all those other things still have to be going on. I'm sure the microfriction, of course, still happens because the joint hypermobility is still there. It's great not to have the big injuries to manage so much, other than, falling off my bike and killing my shoulder. So I do think that there's something about, who knows what it is in plants. I know there's lots of speculation about different things, and I would be lying if I said I knew what it is. I don't know. But I do know that removing them seemed to cool everything down, and things just didn't feel so hot, so irritated, so swollen. And that lowered pain level also allowed me to increase my activity level and strengthen. And so it's all of a piece. I have told people that I've worked with on this that absolutely the carnivore diet made the difference in me being able to change things. But I am pretty convinced that, and it had its own effect, has its own effect, but weight training is part of it too, for me. That if I were just changing my diet and not exercising and not staying strong, I would not be seeing the same benefit that I see today. That for me, both are necessary.
Yeah, and I think one facilitates the other, though. I mean, not having the hot,
Absolutely.
inflamed, unstable joints allows you to exercise, and then
Absolutely.
you get into this
And
positive feedback loop. Yeah.
as we were talking about earlier, I lifted weights, on and off my whole life. And as I said, my first big dislocation was inside the gym. That there's some other effect that's going on for me with the carnivore diet, because I'm lifting pretty heavy weights, and I'm careful. I'm the most careful weightlifter in the world, and I wrap joints that I need to wrap to stabilize them if necessary, and always my knees when I squat and things like that. But, I lift free weights and I squat pretty heavy, and, I haven't had any injuries,
And
so
you've had, if correct me if I'm mistaken, you've had a knee dislocation at some point. Is that correct?
I had a posterior knee
Yeah,
dislocation,
that's
not
a
just a
huge
knee.
thing. Yeah, that's a huge thing. There's all the vessels
Yeah. I
back there
mean,
that you
as
got
you
to worry
know,
about.
and
Yeah.
other trauma people know that posterior knee dislocations are usually a traumatic event. It's the knee to the dashboard, the baseball bat to the knee, some type of blunt force trauma. And for me, I was helping my daughter put her jeans on when she was 6 years old, and I stepped backwards and my tibia popped out behind my popliteal fossa. So, I had a full posterior knee dislocation, which is pretty devastating. I ruptured my ACL completely and my medial collateral, lateral collateral ligaments. The orthopedic surgeon cleaned it all up, polished up the meniscus the best he could, and took out the ACL because he told me it looked like a grenade had blown up inside my knee. He didn't want to try to graft it because, again, the same problems with grafting as we were talking about. So I just wear a brace, an external brace on my knee when I work out. But it's remarkable that it's functional at all. It is truly remarkable. And again, without muscle strength, it would not be functional.
Yeah, and I've seen you. I mean, you still squat, deep all the way, well below parallel. I've seen you. You got a picture of you squatting, what we call ass to grass, basically.
Yeah.
Go down, and obviously flexibility is not an issue for you, but the fact that you can do that and still have a knee stable is
It's pretty amazing. And it used to be that just leaning sideways a little bit, I could feel it going, and I would have to correct back. And I'm still careful. I mean, I certainly am mentally have trained myself, with this knee. And there's some things I'm really, I'm careful with jumping, for example, because I can't be sure how I'm going to land. I'm just extremely cautious with certain things because when I do dislocate it, it's excruciatingly painful. But as far as weightlifting, as long as I am so careful and I'm super focused. I'm never distracted in the gym. I don't screw around. I don't goof around. I don't, chit chat. I absolutely focus on what I'm doing to avoid injuries. With this knee, it's essential, but no injuries in the gym at all. And I push it pretty hard. I really push it. So.
Yeah, I mean, and good for you for doing that. Now, also, I mean, you've managed to lose weight too. I mean, that's another thing. I mean, that's just kind of like run of the mill stuff for carnivore diet. But talk about a little bit about that. You did lose some weight.
Yeah, I mean, I as I said, I had started to gain weight, and that really had never been an issue for me. But the combination of age and not moving like I normally would, that happened. And I mean, I certainly wasn't. Anywhere near morbidly obese or anything, but it definitely weighed more than I ever weighed before. And again, going back to the EDS, people with Ehlers Danlos syndrome can't gain weight. fat weight. They can't gain weight because it's very unbalanced weight, and it adds, our joints are unstable, and then you add all that weight on, and it increases the incidence of injury, dislocation, pain, just pain. And that happens for anybody. You know, that's so much low back pain and knee pain is related to obesity. Right. But for me, 20 pounds may as well be 100 pounds. It just throws me off. It throws my balance off. It makes my back hurt, my knee hurt, my ankles hurt. I can't tolerate it. It's not, and I'm not alone in that. I know plenty of people with Ehlers Danlos syndrome who have the same problem. They just can't handle that extra weight, the fat weight. And I was able to start losing weight really immediately. And I knew I would lose weight. I mean, that was sort of my initial motivation, because I knew that if you cut out carbohydrates, you're going to lose weight. It's, I knew enough to know that it was carbohydrates that make you fat and not fat. That I already knew. So I knew that would happen. It was all the other stuff that I didn't expect. The weight loss thing, I felt quite certain was a given, and that happened quite quickly for me. And then I lost weight, gradually through the first 6 months, I would say, and I hit probably 18% body fat. My BMI is about 21. 20. I haven't checked it, recently, but it's in that range somewhere. I at some point I started actually gaining weight because I had no fat to really extra fat. I was just gaining muscle, but I stopped losing. It isn't like you're going to keep losing weight to this dangerous level. That didn't happen for me. I lost the fat that I needed to lose, and then any weight gain I had, a couple of pounds. I'm not talking about a lot, but a couple of pounds was just muscle mass. Gaining some muscle mass. But after about 6 months of losing fat, I hit whatever I needed to hit, and I've been pretty much there ever since. So.
Well, let me talk a little bit about how hard is it to do this diet in Denmark? Is it difficult to do it
Oh,
there?
it's easy. Danish people love meat.
Okay.
I mean, there's, regular Danish people, yes, as we've talked about in the past, you and I, there is that sort of vegan lobby that is the plant-based diet lobby and stuff that's sort of out there. But overall, I've noticed, and since you and I last talked, it hasn't really made much of an impact. Danes are sort of no-nonsense people for the most part, and the pork farms are a big, pig farms are a big thing here, and beef, and baby back ribs are probably, and bacon are two of the largest exports out of Denmark. Most people, it's not a big thing here. And plus where, Denmark is actually like a large farm. Really, if you look at it sometime, it's a large farm, and there's just cattle all over, and it's very simple for me to go to a local farmer and buy what I need, or a butcher, or the store. So there's really no problem. I've not had any trouble. I mean, I might get some of the same reactions, like, what, you only eat meat, you don't eat plants? I mean, kind of no different than anywhere else, I would say. But I certainly haven't found it particularly difficult.
And what, just out of curiosity, how are you eating? Are you eating, with restricted eating windows? You kind of an intermittent faster? Are you eating a higher protein or higher fat approach? What has kind of been your
I played
strategy?
with both.
Yeah.
Over the last, I played with both. At first, I found it more necessary to make sure I was getting a pretty high ratio of fat with the protein. And now I find that that I just don't want or don't need as much fat. And I don't know, I have to say, one, with this injury, and two, because we were on lockdown for so long and the gyms are still closed. It's like, I swear, the only business that's not going to open in Denmark is the darn gyms. And so the amount of, you know, energy that I'm burning is less in the last 6 weeks, or, you know, whenever it is we locked down in mid-March. I mean, of course I get out, I walk. I mean, we're not like at stay at home. We can go out and get exercise and stuff, but the gyms are closed. And that is my primary, that's how I exercise, is lifting weights. So I'm not burning as much energy as I normally would, being in the gym 4 or 5 days a week. And so I don't know if that's affecting me not wanting as much fat or needing as much fat in my diet. I'm not sure. That's just me speculating. But I noticed lately I like a little higher protein ratio to fat. And it used to be the other way, a little bit the other way around. I do occasionally do intermittent fasting. I tend to do 1 meal a day because that's all I really need. Not because I fell on that by accident before I realized it was a thing. I just found that if I fed myself properly, if I had, you know, a great big steak or two when I ate, I absolutely didn't need to eat again for a while, often until the next day. And that seems to be the most natural sort of eating pattern for me. Is not, and again, I had no idea there 1 meal a day thing. I kind of walked into this little bit blind. You know, like I said, I didn't know what keto was either. I also didn't know what intermittent fasting was, you know, so I had like no idea. But some things just happened that way for me. Once in a while, I've done a couple of 2 or 3 day fasts. I don't find them particularly necessary, but sometimes, you know, I've experimented with it and it's been fine. I'm careful because the other thing that I have that is connected to Ehlers Danlos syndrome is postural orthostatic tachycardia syndrome. So that means I tend to have very, very low blood pressure. And that is much improved on the carnivore diet. I used to almost black out a couple of times a day. If I got up from sitting to standing, everything would go black and my blood pressure would drop and my heart rate would jump up. And that's really stabilized. But I find I have to be careful with fasting, or I can aggravate it a bit.
Do you, I mean, when you talk about tachycardia, what are your thoughts on electrolytes? Are you taking any kind of salts or anything like that?
If I just make sure, I mean, it's been a bit of a shift for me. I was never a salt eater in the past. You know, I just didn't eat salt. And now that I don't eat any kind of processed foods at all, or anything that has salt sort of in it already, I find that I put a little bit of salt on my meat. I tend to use a little pink Himalayan salt or whatever, or I'll cook a little bit more with salt than I used to. And if I do any kind of fasting, I absolutely mix a little bit of salt or whatever, or some electrolytes into some water or warm water to make sure that I stay hydrated. I find for me that it helps. And, you know how, especially if you're working out a lot, or, you know, we've all seen patients that end up hyponatremic and, you know, hypokalemic, you know, low potassium and low salt, you know, from drinking hypotonic water, you know. So I find that works best for me, especially with POTS, with the postural orthostatic tachycardia syndrome. I need to keep enough electrolytes on board, and that's true for almost everyone I know with POTS, that they all know to be sure they're getting enough salt or other electrolytes.
Do you mentioned pork in Denmark and then also beef. Are you eating any much in the way of eggs and dairy, or is it pretty much in fish, or is it just pretty much?
I eat eggs. I like eggs, and I eat eggs. I eat beef, pork. I eat fish. There's a lot of great fish here. You know, salmon, Norwegian caught salmon, usually wild caught salmon. I try to. I mean, I would say most of my food is probably beef, but I definitely also eat a fair amount of pork. I eat wild game when I can get it. There's lots of nice elk, caribou, and up, you know, that I can get, or elk, mainly. And from, I have friends who hunt in Sweden and Norway. And so when I get the opportunity to have wild game, I definitely take it because it's great meat. And maybe you get some little different nutrients from animals that eat a different diet, a wild diet. I eat some poultry. I cook for my family, so I try to not make them bored. So I cook different things. My family, my daughter has been fully carnivore for at least a year now. She's 18, and it absolutely works for her.
Did she have EDS as well? I can't remember.
She does have EDS as well, and so does my son. My son is 16. My husband and son probably eat about 20% of the carbohydrates that they used to eat. So they've reduced them by about 80%. So when I cook, I just make meat. If they want something else, then they can get it. That's kind of how I do it. In the beginning, I tried to cook them a bunch of other things, and every once in a while I'll make them something else. But there's never anything like pasta or bread in the house. If that happens, that's from my husband.
Yeah, it's kind of like mine. I'm usually on the grill cooking up the meat for everybody, and
Right.
then my girlfriend occasionally, she's usually making a cheese board, and it's usually cutting up some different types of cheese, and occasionally she'll throw a little bit of fruit in there, and our son will eat some of that. But it's pretty much the same thing. I cook up all the meat, and then I sit there and eat that. And they have a few other things if they want, and it works pretty well. I've seen in most of my family is on board with eating a lot of meat. And
my whole family definitely. The base of everyone's diet is meat, and my daughter and I, it's exclusively. My daughter is more. She just eats meat. She mostly drinks water. She eats no dairy because she's found that she's a teenager, and she's tested it a few times, and every time she goes back to eating cheese or milk, her face breaks out. So she decided to get rid of that, and she feels better without it. And she just she's been doing great she's absolutely ripped. She's in the gym all the time, and when I look at her compared, we've talked about this, you and I, before too, compared to her classmates, so there's just no comparison. She looks completely different. And I've told you, her high school, or gymnasium it's called here, they're really kind of closer to colleges than American high schools, but their cafeteria is a vegan cafeteria. And so there are a lot of kids who are vegans. And when I look at those kids, a lot of them do not look great. They just don't look great. And it's odd because Danish kids generally pretty fit, pretty trim, pretty, they look pretty good. They're, especially compared to American teenagers. You don't see a lot of heavy kids here, for example. People are pretty active.
They're tall.
And tall.
Very tall. One of the tallest places in the world, in fact. Yeah.
So these kids, I always felt tall at 5'8.5", and now I'm around women who are much taller than I am all the time. But those kids, there's a significantly higher percentage of vegans in my daughter's school because, and a lot of them just don't look great. And I've been watching them now for a couple of years, and some of them I've absolutely worried about. They just look, kind of pudgy and dark circles, and their skin doesn't look good. And I've had long enough of watching them now, and then I watch my daughter, who has just absolutely been thriving on a carnivore diet, absolutely thriving, and not just physically. She blew every single exam off the charts, and is graduating at the top of her class, and is getting ready to go to med school. So she's thriving in other ways as well. She published a best-selling book last year,
Cool.
in her spare time. So
that's pretty good there. So
being a productive kid matters.
How is that the school is vegan? Does that mean you can't get any meat at all?
It's a special school. It's a private school. So it's completely non-reflective of the rest of Danish schools. It's its own thing. It's kind of kind of a slightly more politically left-wingy, kind of a left wing in the American left wing. I mean, like kind of, it's just a little different than, it's not just a regular public gymnasium.
So she has to bring her own lunch in, I guess.
Absolutely.
Yeah.
She does. And in the beginning, she felt a little nervous about it. She was the new kid there. She had transferred to the school, and it's a great school in other ways. I mean, academically, it's a great school, and she liked it for that reason. But, the vegan thing, she felt like she couldn't, she would get dirty looks if she tried to, eat meat in the cafeteria. So she used to go outside. And then after a couple of months of that, she said, forget this. So, she'll sit there. I send her, with chopped up, ribeye steak in a container, and she sits there and eats, steak or, chicken legs, or, she'll bring a whole chicken in and sit there and tear it apart in the middle of the vegan cafeteria. She's completely unapologetic about any of it. So
yeah, I wonder if some of those kids are kind of trying to befriend her so they get a scrap or two.
Yeah, grab her food. Give me that food. Actually, she has kind of converted one over out of because she was really worried about her, because her friend just, she just had big dark circles and looked sick and wasn't doing that well in school because she was having a hard time paying attention, and she wasn't sleeping at night. And so she's helped her friend. She's more of an omnivore now, but she's eating a lot more meat than, she wasn't eating any at all. And she's doing quite a bit better. So that's good.
Well, yeah, one life saved, I suppose, or helped anyway.
Yeah,
so
right.
That's good.
Well, I see a lot of girls, teenage, just speaking as a doctor and as a mom, I've seen a fair number of teenage girls with eating disorders that use veganism as a way to cover their eating disorder. And that's not uncommon. I've seen it not just my daughter's school, but in my professional life, and also just in at other schools and kids that I've interacted with that clearly have eating disorders, but they sort of use being a vegan as a nice sort of semi-socially acceptable cover. Somebody wrote, veganism is an eating disorder. You're right. I can't disagree. But it's socially acceptable, where being bulimic or anorexic isn't. And so, I've seen, in particular in teenage girls, quite a bit of it.
Yeah, it's a shame, and we see that for sure. Well, Dawn, it's been a pleasure. We've gone right at an hour, just kind of flew by. Typically we go for an hour.
It's always nice to talk to you.
I'm looking for, are you, I don't know if we're going to get this thing in Sweden going or not. I'm not sure if it's
the meetup. Unfortunately for him, it just, everything happened right as we were about to all meet up. But I guess we'd all be better off meeting in Denmark. Originally it was in Denmark, and then he moved it to Sweden, right?
Yeah, I think for some reason the hall that they'd rented in Copenhagen was, they changed the price on him and raised it dramatically, and he said that he just can't afford it, so he went to Malmo, Sweden.
Yeah. Well, he might want to recheck. And Sweden's definitely their pandemic, it's pretty wildly out of control there right now. So we'd be better off in Denmark. We have very few cases right now.
Interesting. Yeah, maybe they're eating more meat there. I don't know. It's kind of interesting. I hate to speculate. I know Hong Kong has had a tremendously low rate, and they're eating a ton of meat there. It's you can't. Really
I don't think Sweden eats any more meat than we do here. I mean, I think that the Nordic nations,
it's pretty standard.
They're all pretty similar.
Yeah. Well, very good. Well, anyway, Dawn, thank you so much. Look forward to chatting with you again. I'm sure people have enjoyed this. I'm glad we got through our little technical stuff at the beginning.
Yeah, sorry about that.
Anyway, you guys have
a great. Tested that.
Well, that's okay. It's something you just have to react when it happens. You guys have a great day, and we'll talk to everybody in the coming future near soon.
Okay.
Bye-bye.
Great.
Thanks.